Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the drug acting on the CNS. Drug acting on the CNS nervous system. First is the definition, classification, pharmacological action, dose, indication and contraindication. General anesthetics are drugs which produce reversible loss of all sensation and consciousness. The cordial features of general anesthesia are: first is the loss of all sensation, especially pain. Next is the sleep and amnesia, immobility and muscle relaxation, abolition of somatic and autonomic reflexes. Next is the stage of general anesthetics. General anesthetics cause an irregularly descending depression of the CNS. The higher functions are lost first. Progressively lower areas of the brain are involved, but in the spinal cord, lower segments are affected somewhat earlier than the higher segments. The description of these stages still serves to define the efforts of light and deep anesthesia. Important features of different stages are: first stage, analgesia state. Patient is conscious and rational with decreased perception of pain. Stage 2, delirium stage. Patient is unconscious, body respond reflexively irregular and breathing pattern with breath holding. Stage 3, surgical anesthesia, increasing the degree of muscle relaxation, unable to protect airway. Stage 4, medullary depression. There is depression of the cardiovascular and respiratory centers. Next is the property of an ideal anesthetic. For the patient, it should be pleasant, non-irritating, should not cause the nausea or vomiting. Induction and recovery should be fast with no after effects. For the surgeon, it should provide adequate analgesia, immobility and muscle relaxation. It should be non-inflammable and non-explosive so that the cautery may be used. For the anesthetist, its administration should be easy, controllable and versatile. Margin of the safety should be wide. No fall in BP, heart, liver and other organs should not be affected. It should be potent so that the low concentration are needed and oxygenation of the patient does not suffer. Rapid adjustments in depth of anesthesia should be possible. It should be cheap, stable and easily stored. It should not react with the rubber, tubing or soda lime. In today's class, I discuss about the stages of general anesthesia and also about the general anesthetics. Thank you for watching.